Third presenter, Miss Anum Bashir, Jinnah Hospital, Lahore, to welcome Miss Anum.
Presentation. Thank you. Bismillahirrahmanirrahim. Assalamu alaikum to all of you. My name is Anum Bashir. I am working as a charge nurse at Jinnah Hospital, Lahore. In this session, I shall facilitate you on the topic same-day discharge protocol and post-procedure follow-up. I hope we shall learn together from each other. I have a following outlines of the presentation. Same-day discharge. What is meant by same-day discharge? इस लफ्ज़ से हमें क्या समझ आती है? In our routine setup, healthcare workers, physicians and most of the time patient itself demanding होते हैं कि हमें कम से कम हॉस्पिटल में रखा जाए. कार्डियोलॉजी के इंटरवेंशन सेटअप में जनरल एनेस्थीसिया की इन्वॉल्वमेंट ना होने की वजह से जनरल केसेस डे केयर किए जा सकते हैं. सो इन माई कन्वर्सेशन आई डिवाइड माई टॉपिक इंटू टू कैटेगरीज. नंबर 1, किन पेशेंट्स को हम सेम डे डिस्चार्ज कर सकते हैं और किन पेशेंट्स को हम नहीं कर सकते. So we have a certain checklist for those patients who are eligible for same-day discharge, but make sure whether patient is fit enough to be discharged or not. A stay after a coronary angiography, percutaneous coronary intervention, and non-surgical procedures that does not include supervised overnight monitoring in the facility or hospital. Stay for routine monitoring of variable duration after the procedure based on factors such as access sites and procedure characteristics. Typically be discharged within 12 hours after arrival at the facility or catheterization laboratory. So what are the factors which should be considered for same-day discharge? Pre-PCI consideration, post-PCI consideration, pre-discharge checklist. Pre-PCI considerations includes clinical factors, social factors, staff system factors. Clinical factors includes physician input about whether patient is a candidate for STD. Social factors, caregiver available if needed, patient willing to go home. Staff system factor, scheduler inform patient about possibility of STD. Schedules PCI early enough in a days to allow for reasonable observation before STD. Post-PCI considerations includes clinical factors, social factors. In clinical factors, complication during after procedure, success of PCI, exacerbation of disease, change in mental status from baseline. In social factors, patient willing to go home. In pre-discharge checklists, plan have been made for administration of antiplatelets loading dose, prescription for antiplatelets aspirin and statin, referral to cardiac rehab, follow-up call with patient, and follow-up appointment. Education provided on monitoring access sites, emergency number 2 call. Then what inclusion and exclusion criteria should be followed for the same-day discharge? Inclusion criteria includes, number 1, elective PCI for stable or crescendo angina or asymptomatic but positive stress test for all stenosis or coronary computerized tomography. Number 2, successful PCI. Number 3, no angiographic evidence of untreated intimal coronary dissection. Number 4, absence of unresolved post-procedural chest pain. Number 5, systolic blood pressure lower than 160 at the time of discharge. Number 6, absence of vascular complication at completion of PCI. Number 7, PCI performed before 3 p.m. to allow 6 hours of observation before discharge on the same day. Exclusion criteria includes non-ST elevation MI or ST elevation MI. Number 2, complex PCI. Number 3, significant procedural complication, for example, prolonged chest pain, transient closure, no flow or slow flow phenomena. Number 4, unresolved periprocedural or electrical instability. Number 5, serum creatinine greater than 2. Now I explain my topic with a brief example from admission to same-day discharge. एक पेशेंट हमारे पास आता है जो पेन, पैल्पिटेशन एंड सिंकपी की कंप्लेन करता है. देन प्रोसीड फॉर एडमिशन. इस पेशेंट पे हम 3 एवेल्यूएशंस करेंगे: प्री प्रोसीजर एवेल्यूएशन, पोस्ट प्रोसीजर एवेल्यूएशन एंड ड्यूरिंग प्रोसीजर एवेल्यूएशन. प्री प्रोसीजर एवेल्यूएशन में सुटेबल कैंडिडेट है, अर्ली केस है, मेडिकेशन अरेंज्ड है, रिलायबल केयर टेकर एंड ट्रांसपोर्ट अवेलेबल है. प्रोसीड फॉर ड्यूरिंग प्रोसीजर एवेल्यूएशन. No procedural complication, no new AV block, finished before 4 p.m., no surgical intervention. Post-procedure evaluation, no new pericardial effusion, no new AV block, 4 to 6 hours of observation, hemodynamic stability, no assessed site complication. अगर एक पेशेंट ये सारे क्राइटेरिया को फुलफिल करता है, then go for same day discharge, otherwise overnight monitoring. There are few checklists: pre-procedure evaluation checklist, post-procedure evaluation checklist, and pre-discharge checklist. In pre-procedure evaluation checklist, is the patient experiencing STEMI or NSTEMI? If no, then proceed for STT, otherwise yes, then go for overnight monitoring. Does any member of a care team feel for any other reasons that the patient is not a candidate for same-day discharge? Number 3, does the patient have adequate caregiver support? Number 4, can the patient or a caregiver reach 1122 if necessary? Number 5, is the patient willing to be discharged the same day? Is the patient scheduled early enough in a day so that they can be observed for sufficient amount of time, 4 to 6 hours post-procedure discharge at a reasonable time? अगर पेशेंट ये फर्स्ट लाइन सारे क्राइटेरिया को फुलफिल करता है, देन गो फॉर STT, अदरवाइज ओवरनाइट मॉनिटरिंग. पोस्ट प्रोसीजर evaluation भी सेम एज इट इज़ है. Did complication occur during the procedure? Was PCA successful? Is the patient experienced any of the following post-procedure: stroke, bleeding, vascular complication? Is there any exacerbation of any underlying disease, for example, heart failure, diabetes, COPD? Is the patient mental status the same as the baseline presentation? Is the patient willing to be discharged the same day? In pre-discharge checklist, confirm that loading dose of antiplatelets has been administered. Confirm patient have received prescription for at least 30 days of antiplatelets. Confirm prescription for aspirin and statin. Confirm referral to cardiac rehab. Name of the person responsible for following up with patient. The cath lab has provided education to patient on how to monitor assessed sites. The cath lab has provided the patient with an emergency number to call. The cath lab has scheduled a follow-up appointment. अगर पेशेंट इन सारे क्राइटेरियाज, इन सब चेकलिस्ट को फुलफिल करता है, देन गो फॉर सेम डे डिस्चार्ज, अदरवाइज ओवरनाइट मॉनिटरिंग. Following all the checklist, we have a benefits of the same day discharge. Number 1, patient preference and satisfaction. Safety, no safety difference between same and next day discharge following PCI, but 8% of hospitalization are associated with highly undesirable events such as hospital acquired infection or fall leading to injury. For example, coronavirus, Congo fever, and monkeypox. Ward provided an undesirable environment for recovery due to lack of privacy, frequent interruptions, awakening for examination, and or blood draw, or a plethora of unrelenting noises, leaving patients susceptible to post-hospitalization syndrome. Increase inpatient bed availability. Same-day discharge may offer facility or hospital and economic advantages. Now I explain my topic in flow chart summary. मतलब फाइनलाइज कर रही हूँ इसको मैं एक फ्लो चार्ट समरी में. कैथ लैब प्रोसीजर हो गया है पेशेंट का, रिकवरी कर रहे हैं हम कैथ लैब प्रोसीजर रिकवरी एरिया में. एम्बुलेट करेंगे 2 आवर्स बिफोर डिस्चार्ज इफ़ एलिजिबल फॉर STT. और इसमें डिपेंड करता है कि पेशेंट की प्रेफरेंस या फैमिली प्रेफरेंस बहुत इंपॉर्टेंट होती है. फॉर एग्जाम्पल, पेशेंट विलिंग टू गो होम. और नॉट एलिजिबल फॉर STT इफ सीरियस कॉम्प्लिकेशन एट वैस्कुलर साइट, सेम डे प्रोसीजर रिलेटेड कॉम्प्लिकेशन आ जाए. ये पिक्चर हमें कुछ शो करती है. Pushing the limit of same-day discharge. Generally, हमारे पास same-day discharge have a lot of limitations, high threshold. But considering the checklist of safe parameters, post-procedure, we can extend the boundaries of the limitation of same-day discharge. Thank you.
Thank you, Anum Bashir. Very knowledgeable presentation. I think last presentator रेहान मलिक तब्बा हार्ट इंस्टीट्यूट के, वो शायद किसी एमरजेंसी की वजह से नहीं आ सके, तो हम इंशाल्लाह इसको हम यहीं ख़त्म करते हैं. I would like to thank all the wonderful people who present their presentation to evening on my behalf. An amazing lineup. All of you taking in time out of your busy professional and personal professional schedule. I am looking forward to hearing more about the implementation of the outcome of this meeting during the Pakistan Life Interventional Cardiology Meeting 2022. Most informative and interesting piece of knowledge. Thanks to Allah and thanks to all of you. Thank you.
Thank you, Ishfaq Saab. So now we're going to have the quiz. So we'll be passing out some questions regarding all the talks today. Okay, nobody got it. So anyway, so some great talks today. I think a fantastic turnout. There was really a good number of topics that were covered in quite a lot of detail. And I think really hats off to you for staying throughout the day and listening to all the talks and the speakers and making sure that this current symposium, today's event, was very, very successful. Again, I'd like to thank the PSIC leadership, all the panelists, and the chairpersons, the moderators. I think it was a team effort. And I've been going back and forth between the two rooms, and I've been very impressed by the quality of the talks that were driven, the enthusiasm with which the talks were given, and I think this is a great trend, and every year I can see that it's going to keep getting better and better, and I'm glad I had a little bit of part to play in organizing this. So thank you, everyone. Take care, and hopefully you'll stick around for the rest of the meeting over the coming weekend. Thank you.